Ultrasound that haunted me. I still remember my days as an intern completing my medical training in Mexico. One of the most challenging rotations was obstetrics, where I assisted with high-risk pregnancies, C-sections, and deliveries. But there's one case that still sends shivers down my spine. It involved a young woman, who we'll call Jane, from an country. She arrived at our hospital's emergency room in distress, sweating, and experiencing pain. A mentor tried to communicate with her, but the language barrier was significant. I was tasked with performing an ultrasound while he went to find a translator. As I started the scan, something felt off. The uterus was unusually large, and when I finally got a visual of the fetus, it looked wrong. The more I moved the transducer, the more unsettled I became. Just as I was scanning the head of the fetus, Jane's arm gripped mine tightly, and she started to agitate. Saying incomprehensible words, I dropped the device in shock. A mentor rushed into the room, ordered me out, and closed the door. A few seconds later, a blood-curdling scream pierced the air, drawing staff from nearby rooms to assist. They whisked Jane away to another hospital. The next day, I learned that my mentor had resigned due to personal reasons. Every time I asked about the incident, people gave me vague excuses. You fainted, you felt sick, or you had a panic attack from overworking. Years later, as a licensed medical doctor consulting patients on my own, I ran into an old colleague who worked at Jane's transferred hospital around that time. He revealed that they were expecting a high-risk pregnancy arrival, but never received it due to a tragic ambulance crash. The possibility of Jane being involved still sends chills down my spine. To this day, whenever a patient comes in for an ultrasound, I'm terrified to see the images and relive that traumatic experience.